Hello, I'm Tony with Tony's World. Today, we'll be talking to a good friend of ours, Dr. Knizer, with PC Medical and Claret Medical Laboratories. Today, we have had some people that has emailed us in and asked us some questions, and we're going to start off here, firsthand here, asking Dr. Knizer some questions. We have a question that came in from Bob. He wants to know why he gets tired in the afternoon. It never happened to him before, and he's asking why he's having trouble controlling his weight. It keeps going up even though he's on a diet and he can't seem to lose weight. How do you feel about that, Dr. Knizer?
Well, Bob, there's one issue going on right now, and I think you're aging, number one, and your hormones change when you age. Look back when you were young and when you had all the energy in the world. You were 25, you had the hormones of a 25-year-old, you were able to build muscle mass, you could stay up late at night, you could watch that late movie. Now that you're getting older, it gets more difficult. You get fatigue late in the day, you lose energy, you may even have some performance issues with your family. And I think we have to look at the basic cause of that. And now the number one cause of that is testicular failure. Now, all men will go through menopause. I know that's a horrific thought. I'm going to go through menopause. I'm a man. We don't call it menopause in men. We call it andropause. But it will happen to you. It happens to 100% of men. It happens to women, and we're much more familiar with it happening to women. Now let's address the first thing you said. I'm putting on weight and I can't seem to control it. Weight is calories. You are and we are a sugar machine. That means our bodies run on sugar. If we can metabolize that sugar, it will not accumulate in the body. If, however, we lose the ability to metabolize that sugar, any excess sugar in the body will get converted to fat. Now, the thyroid gland controls your basal metabolic rate. That accounts for 60 to 70% of your calorie burn. The other 30 to 40% is controlled by your musculoskeletal system, and that is under the control of testosterone. As you age, your testicular function goes down at 1 to 3% a year. Now, if you're in that 3% group, by the time you're 45 to 50, you will be below the recommended level, which Mayo Clinic says is 700 testosterone. You might be down at 200, 300, 400, and in that case, your body is taking those sugar molecules and it's not metabolizing them the way you were before, even if your thyroid function is still the same. Now, you've got half of that 30, 40% not burning. Where does it go? It goes to fat, and it's stored as fat. So that's why whatever your college weight was, by the time you're 35, it's up 5 or 10 pounds. By the time you're 45, it might be up another 10 pounds. We call that a middle-age spread. Some places we call it the Buddha belly. The reason for that is when your body is going to store sugar as fat, it goes right here. That's called the omental fat pad, and it's meant to protect your stomach from injury, but it's a great place for accumulation of fat. Women have a little different issue there. When they go through menopause, it's a more abrupt phenomenon, and they stop metabolizing altogether. That 30, 40% goes right away. Now, some will go to the mental fat pad, but the rest will go to their hips and thighs, and the women are much more aware of the weight gain when that's going on. Your second issue, Bob, was mental fatigue. And testosterone is the hormone that modifies your mental acuity. And as that goes down, your ability to hold those thoughts late in the day, to work on the job late in the day, that will go down. So all of those things are hormone related. And so it's very important you get your hormones checked. Very important that you have it checked by someone who understands hormones. The reason I say that is if you look at every laboratory report, and I did laboratory reports for a community hospital for 35 years, and I can tell you every one of them said testosterone level 250 to 1,000. When we set those up years ago, we did not appreciate that 30 to 40% of men in the United States are low T. Now you take that 30, 40% of men off that scale, you'll be in the range where the Mayo Clinic says you should be 600 to 1,000. Our target is 700. So don't be ashamed to say you're a man going through andropause or male menopause. It happens to all of us. It's going to happen to all of us sooner or later.
Out in the audience today, we have a question that comes in from Amy. And Amy asks, wants to know about hot flashes, night sweats, and depression and irritability.
Amy, that's called menopause again, and in women, it's that PMS woman coming out. Now, women differ from men only in how it comes about. Remember I told you a man drops down from a high of 1,000 down to 600, 700, maybe even less in the next 20, 30 years. In women, it's not so nice. They go along functioning normal hormones, normal rhythms in life, and then all of a sudden, their hormones will drop from whatever the values are to absolute zero. Estrogen will become zero. Progesterone will become zero. Testosterone will become zero. So while all of that is happening, their life takes a big change. And we can look at each of the hormones and we can assign symptoms to them. And actually, in our practice, we actually do that. We have a questionnaire which looks at symptoms by hormone. And what she is talking about, the hot flashes and night sweats, are estrogen symptoms. As estrogen falls, the pituitary gland right here in the middle of the head looks in the bloodstream. It doesn't see the estrogen it wants. It starts secreting follicle-stimulating hormone. That follicle-stimulating hormone goes way up. Estrogen goes way down. That's hot flashes and night sweats. Now, it's very simple. If you know what you're doing is to bring that estrogen up, the follicle-stimulating hormone goes down, hot flashes, night sweats go away. A lot of other things are going on because you're having 3 hormone deficiencies. When progesterone falls, progesterone is a dehydrating agent. It goes to the brain stem, and it takes some fluid out of the brain stem, and that makes you a much more pleasant person. When that comes back, it causes irritability, depression, anxiety, the classic PMS woman. So our goal in treating there is to get your progesterone back into a range that those symptoms go away. It's a dangerous place because so many times a woman will see a physician for depression, and the physician, if he's not hormone savvy, he will actually treat the depression as a disease when it's actually a symptom of menopause. And if he would treat the menopause, all of those symptoms will go away. So that's very important that you go to a doctor who's a specialist. Now, not many physicians are specialists in hormone therapy. And it's easy to explain. Bioidentical hormones, which is what you want to be treated with because they are actually identical to your hormones, and there's no side effects, they're all natural. They've only been around for about 15 or 20 years. So when most of us went to medical school, they weren't around. And even after medical school and postgraduate training, there weren't many specialists who specialized in hormone therapy. Now today there are more and more groups across the country who are specializing in hormone therapy. That's what we do. And because of that, we know what to look for in menopause. The last hormone to mention in menopause is testosterone. Most men, or even women, don't think that women have testosterone. Well, of course they do. They have musculoskeletal systems. Now, it is only normally 1/10 of a man, but that's enough that uses 30 to 40% of their calorie intake. They have smaller muscles, but they got just as many muscles throughout the body, and they have to be maintained. And when a woman goes through menopause, I guarantee you, we measure their hormones in our laboratory, laboratory, it will be 0. And unless you get it off the floor, they're not going to feel better. Their muscles will waste just like they do in men. When men go into menopause, their muscles, instead of building as they did in their youth, they waste and start to go away in old age. And women will start to waste, and in addition to not having that non-calorie burn, they'll put on fat weight, they'll lose their muscle tone, they'll get restless leg-like symptoms, they'll get fatigue symptoms, and mental clarity, get fuzzy thinking. And last, but very important to a lot of men and women, libido changes. You don't care about sex anymore. That's the libido loss. And you want to have that restored. And it's I was going to say it's not rocket science, but it is science. You have to know what hormones to give, what dosages to give them in, and how often to repeat them. So, Amy, you've got issues to deal with. you should go to someone who can deal with those issues. And if your family doctor is uncomfortable doing that, we're always available. And we work hand in glove with a patient's private physician. The last thing we do with both the men and the women is we treat the whole patient. When you come in, we do what is called the Boston Heart Diagnostics, which is 66 tests run at Tufts University in Boston. And they look at your liver function, your kidney function, your thyroid function, your genetics, what you inherited, your rate of atherosclerosis, your rate of whether you're susceptible to diabetes, stroke. We put all that together, and the last thing they look at on every report is your hormones. So we look at the whole patient. And I think in that vein, I will mention to you that this is very time consuming, what we do. Looking to the patient, talking to the patient, looking at their tests, running tests in Boston, running tests here, all takes time. And we know that, so we only schedule 6 to 8 patients a day because we want to be able to spend a half hour, 45 minutes, an hour and a half with the patient, talking about their problems, seeing what needs to be done. And about a year ago, we wanted to tweak this process one more step, and that's where Clarity Laboratories came in. We felt that the patient ought to be able to go to one doctor, one visit, be able to express their symptoms, have their blood levels checked, have their dosing diagnosed by a doctor, and then get their pellet treatment, and then be followed by that doctor. And by bringing on board in our office a CLIA-certified laboratory, we can do all of that. One last thing I'll say is follow-up. We follow our patients. We require them to come in usually 4 times a year after their established treatment is put into effect. And then we stay with the patient. We continue to follow them. We repeat the Boston because we want to make sure that when we do the Boston, we set up a lifestyle program, a diet program, an exercise program, and a hormone therapy program, that it works. And the way to do that is to repeat that Boston in 3 months, 6 months, and a year. And if it's not working, we can tweak it. We can change your exercise program, change your diet program, adjust your hormones. We deal with the whole patient. Now, lastly, I'll say, not all hormone therapy practices are the same. We are the only one I'm aware of in the state of Indiana, maybe in the Midwest, and maybe in the country, that has a CLIA-certified laboratory in the office for the patients. And that was a unique process that Amy Harvey and our team put together, fostered it, traced it, pushed it, and now it's actually in place. And it's been up and running for a year almost. So she deserves some kudos for that.
Well, and today, Doc, we're about out of time here with this program today, but we want to say thank you for coming on our show today. We had a fabulous show, and be looking for us to do the Medical Minute here with Dr. Knizer. He'll be answering all of our medical questions here in Medical Minute. So if you have questions out there, be sure that you email them to us at Tony'sWorld.net. Thanks,
Yep.
Doc. Okay. Can I start over there?